What is the most common cause of hypercalcemia in UK hospitalized patient? So we have to find out the most common cause of the hypercalcemia. This is the most common cause of hypercalcemia in UK. Here are the options. Options are thiazide use, metastatic malignancy, primary hyperparathyroidism, osteogenic sarcoma, and sarcoidosis. So we have to find out one of the option, which is the most common cause of hypercalcemia in case of hospitalized patient. This point is very important. It is the hospitalized patient. There is the two option. One is the hospitalized option patient, another one is the outdoor patient. So the hypercalcemia, the cause, it may be malignancy or it may be the primary hyperparathyroidism. And in case of malignancy, the malignancy cause of the hypercalcemia, the present with the cancer with the hospital, and then he or she diagnosed hypercalcemia. And in case of primary hyperthyroidism, there is no massive acute emergency condition, so usually patients are not hospitalized. And in case of outdoor basis, this type of patient are detected. So hypercalcemia, another causes, less common causes are sarcoidosis, thiazide and lithium, immobilization longer time, Paget disease, vitamin A or vitamin D toxicity, thyrotoxicosis, Mann syndrome, and milk alkali syndrome. So they are the least common cause of the hypercalcemia. Our most common cause is malignancy and primary hyperparathyroidism. Among them, the malignancy, it is due to the hospitalized, and the primary hyperthyroidism, it is diagnosed in outdoor basis or chamber basis. And the clinical feature of the hypercalcemia, it includes stones, bones, abdominal groans, and psychic moan. That means painful bone, abdominal groan, renal stone, and psychic moan. So again, painful bone, renal stone, abdominal groan, and psychic moan. These are the clinical features of the hypercalcemia. And high level of the calcium, it causes decreased neuronal excitability, because the calcium is a neurosedative. So the calcium is a neurosedative. When there is high level of calcium in the blood, in this condition, brain sleeps. When brain sleeps, the person sleeps. Sluggish reflex, muscle weakness, and constipation may occur as a adverse effect of the hypercalcemia. So what is the most common cause of the hypercalcemia? In case of the hospitalized patient, it is the metastatic malignancy. And primary hyperthyroidism, it present in case of non-hospitalized patient. And sarcoidosis, osteogenic sarcoma, and thiazide use, they may cause the hypercalcemia, but very little amount.